Let's talk about obstetric fistula. It's a name you might not have heard, but it's a devastating childbirth injury that affects millions of women, mostly hidden away from the world. But here's the thing. This is an absolutely solvable crisis. And in this explainer, we're going to break down exactly how.
This quote from a surgeon on the front lines, wow, it just gets right to the tragic heart of the matter, doesn't it? For these women, surviving days of agonizing labor isn't the end of their ordeal. No, it's just the beginning of a whole different kind of suffering.
So what exactly is an obstetric fistula? Well, imagine a labor that goes on for days without medical help. The pressure of the baby's head can actually cut off blood flow to the mother's internal tissues. Those tissues die, and they leave a hole, an abnormal opening between the birth canal and the bladder or rectum. The result? Constant, uncontrollable leakage.
But here's what's crucial to understand. This isn't just a random medical complication. It's a condition of profound inequality. To really get it, we need to look at who it happens to and where.
And this chart just makes the divide so incredibly clear. In wealthy countries like the US or in Europe, fistulas are super rare. When they do happen, it's usually because of a surgical accident or maybe cancer treatment. But in low-income regions, the overwhelming cause is prolonged obstructed labor, something that a simple, timely C-section almost always prevents.
So who are the women most at risk? Well, the profile tells a story of complete vulnerability. We're often talking about very young women, maybe in their first pregnancy, who are undernourished, live in extreme poverty, miles and miles from the nearest clinic, with no trained professional to help them give birth. The deck is already stacked against them before labor even begins.
And this one injury spirals into a catastrophic life event. The consequences just ripple outwards, destroying a woman's body, her family, and her entire place in her community.
The first and most devastating blow is the loss of the baby. After all those days of agonizing labor, the baby is almost always stillborn. A fetal mortality rate of 92%. Just let that number sink in. The event that was meant to bring new life instead brings unimaginable loss. And then, injury.
For the mother who survives, the physical damage is just relentless. That same pressure that creates the fistula, it can also cause permanent nerve damage, sometimes making it impossible to walk properly. It leads to chronic infections, kidney failure, and often, infertility. It's a life of constant pain and physical misery.
And as awful as the physical pain is, it's often matched or even exceeded by the social devastation. Because of the constant leaking and the smell, these women become total outcasts. These numbers here, they really quantify that isolation. About half are divorced or abandoned by their husbands. Almost all of them are shunned by their friends and communities. They can't work. They suffer from crippling depression. They are hidden away, living what can only be described as a social death.
And the scale of this problem is just immense. While much of the world has forgotten this injury even exists, there are at least 2 million women living with it right now, and somewhere between 50 to 100,000 new cases develop every single year.
Okay, so after all of that devastating news, there is a crucial, powerful ray of hope. This condition, which seems so hopeless, actually has a remarkably effective solution. And here it is. This is the most important takeaway. Fistula is repairable. With a skilled surgeon, the success rate for closing that hole is over 80%, sometimes even higher. A single operation can physically heal a woman's body.
And the change is, well, it's just transformative. Look at this. Before surgery, only 20% of these women felt satisfied with their lives. After a successful repair, that number skyrockets to 90%. It is not just fixing a physical problem. It is giving a woman her entire life back.
But the wounds from fistula run so much deeper than just the physical. True healing needs more than just stitches. It's about rebuilding a woman's confidence, her relationships, and her place in the world after years of trauma.
So the best care programs follow a really clear path. Yeah, it starts with the surgery, but it has to include psychological counseling to heal from the years of trauma and isolation. It often includes job training so she can support herself again. And crucially, it involves educating her community so they can welcome her back without that horrible stigma.
And this right here, this is the ultimate goal. It's not just about being dry, it's about feeling yourself again, reclaiming your identity, your dignity, and your future. That's what true success looks like.
Now, treatment is life-changing. It's a miracle, but we have to address the root of the problem. The real goal has to be creating a world where no woman has to suffer from this in the first place.
And when you look at the economics of it, the case for prevention is just undeniable. A complex fistula surgery can cost over $1,000. But a C-section that prevents the fistula from ever happening, it can be as little as $40. It is so much more cost-effective to prevent the injury than to repair the damage later.
So if it's cheaper to prevent, why is this still happening? Well, the barriers are systemic and they're huge. There aren't enough hospitals, especially in rural areas. There's no way to get to one if you need to. Families can't afford the cost of care, and there's a critical shortage of trained doctors and surgeons where they're needed most.
Which brings us to our final, critical question. We have the medical knowledge. We know the solution is cost-effective. The challenge here isn't a scientific one. It's a challenge of political will, of investment, and of a global commitment to making sure every single woman has the right to a safe childbirth. So what will it take to finally end fistula for good?